On today's show, spreading awareness of the HIV/AIDS epidemic is one of my biggest advocacies as a Fulton County Commissioner. We will hear from two Board of Health experts who will join us in an informative discussion of what you can do to help combat the HIV/AIDS epidemic in Fulton County. And later, in case you missed it, take a ride with me down Martin Luther King Jr. Drive for the 4th annual Juneteenth Parade and Music Festival. I'm Commissioner Natalie Hall, and the district is next.
Hi, Mom, heading out. Later, Gator. Drive safe.
I will. And don't forget to call me when you get there.
I know.
And don't forget to put your phone away.
Already did.
And you drive safe too, mister.
There. Can I tell you a cat joke? Just kidding. Why did the girl ask the mushroom to dance? Because he was a fun guy. What do you call a pig that knows karate? Pork chop. Why was the basketball court all wet? Why? Because the players kept dribbling all over it. Can I tell you another one? So how does a tissue dance? Put a little boogie on it. What's Beethoven's favorite fruit? Banana. What is a boxer's favorite drink? Fruit punch.
Welcome to the district. I'm Fulton County Commissioner Natalie Hall. Today, more than ever, we have a great opportunity to address the local concerns of the HIV/AIDS epidemic. I continue to carry on the legacy of the late Fulton County Commissioner Joan Garner by fighting the good fight to help end HIV/AIDS in Fulton County. In doing so, I asked for over $600,000, which was approved and included in this year's budget for enhancements to Fulton County's HIV/AIDS testing and education, as well as treatment programs and services. The allotment will help to hire nurse practitioners, disease intervention specialists, nurse technicians, health coordinators, and medical records assistants, ultimately expanding the availability of pre-exposure prophylaxis, commonly referred to as PrEP, increasing the availability of HIV testing and increasing the availability of healthcare services for people who test positive for HIV. Today, I have on the show two Fulton County Board Health experts, Derek Wilson, Director of Sexual Health Promotion and Chief Clinical Officer for Communicable Diseases, and Dr. David Holland. Their advocacy to decrease the stigma surrounding HIV has helped educate those who are afraid to explore information and services, in addition to safer methods that will help reduce their risk of being exposed to HIV and other sexually transmitted diseases. Derek Wilson and Dr. Holland, welcome to the district.
Thank you for having us. It's my pleasure to be here.
Thank you. So please explain to us, what is the difference between HIV and AIDS?
Okay. Well, HIV it's an abbreviation, and it stands for Human Immunodeficiency Virus, and that is a virus that actually causes the HIV infection, and also in people that are left untreated, it causes AIDS. And what happens is that people that get infected with HIV, if it's left untreated, virus will eventually eat away at their immune system to the point where it's severely damaged. At that point, they become susceptible to certain infections, and in that state, that's what we call AIDS, which it stands for Acquired Immunodeficiency Syndrome.
And how is HIV transmitted?
Well, the most common way that it gets transmitted is through sexual intercourse. There's also people that can acquire it through sharing needles when they inject drugs. And, there are, used to be a lot of cases of people getting it through blood transfusions and things like that, but that has pretty much been eliminated due to safeguards that are in place in the blood supply.
What does it mean to have a negative or a positive test result?
So when somebody gets an HIV test, it's usually a test for the antibody to the virus. So it's a test for the body's response. And when that test is positive, it means that they've been infected with the virus. Now, that doesn't say anything about their immune system or anything else. It just says that they're infected. And we have to do some additional tests to find out, I guess the way you'd say it is how bad the infection is or how far along it is. But anybody that gets a positive test is infected, and for all intents and purposes, everybody that is infected, based on current guidelines, should be treated.
All right. Well, what can a person do to avoid getting HIV, and what can people who are living with HIV do to avoid passing the virus on to others?
This is a very good question.
Yeah.
Short of not ever having sex, which is not something that we ever recommend. I mean, the whole purpose of the sexual health program at the Fulton County Board of Health is to help people have, a healthy and complete sex life.
Yes.
So, condoms are effective. A lot of people have, for various reasons, chosen to stop using condoms. And for those people, we strongly recommend using pre-exposure prophylaxis, or PrEP, as you were talking about, which is a very, very effective means of preventing HIV. And we can, the Board of Health provides it for free. For people, we can get it for pretty much anybody.
Can you say that again?
We provide it for free. We can get it for free for pretty much anybody. And there's some other places around that offer it too. There's a website called preplocator.org where people can go to find a provider near them that can provide it if they don't want to come to us.
That's outstanding.
But the rest of your question, though, about what can people that are HIV infected do to safeguard their partners, the most important thing is to be on medication, because contemporary HIV medication reduces their viral load, the amount of virus in their blood, to undetectable levels. And when people, and this is very, very important, when people that are infected with HIV have an undetectable viral load, they cannot transmit the virus to their partners.
Wow.
Period.
Amazing.
They cannot. And so we have very, very effective means of preventing people from passing it on, and also very effective means for people who are HIV negative to stay that way.
That is outstanding. Well, how often would you recommend that people get tested?
We recommend that every adult get tested at least once a year. People that are more sexually active need to get tested more often, at least 2, maybe 4 times a year. And certainly if there's been any fear of some specific exposure or something like that.
Okay. Well, let's take a break, and when we come back, more with Derek Wilson and Dr. David Holland. Stay with us.
Home fire drills give your family a plan of action. In a home fire, you may have less than 2 minutes to get out. So when you drill, show everyone 2 ways out of the house, pick a safe meeting spot, and get there in under 2 minutes. Then practice home fire drills at least twice a year. You can even make them fun. So everyone knows the sound and exactly what to do when they hear a smoke alarm. Go to ready.gov/fire drill and learn how to prepare your family for home fires.
I see you mobbing over her. Let's go. Let's mob. Let's crawl. Let's crawl. Let's crawl. Hey, yo, we mobbing. Come on, girl. Let's crawl. Hey, yo, let's crawl. Hey, yo, let's crawl. Hey, let's crawl.
Welcome back. We've been talking to Fulton County Board of Health experts Derek Wilson and Dr. David Holland. Fulton County's comprehensive strategy to end HIV/AIDS is in full effect. From partnering with the Elton John Foundation to attending a Fulton County HIV/AIDS Prevention, Care, and Policy Advisory Committee meeting, these strategies will help combat the issues which affect our most vulnerable populations. Derek, what is the Fulton County Board of Health plan for combating the local HIV epidemic?
Sure, that's a really great question. The first thing that we really want to do is make sure that we're leading on the topic, to make sure that the community understands that we're really engaged in ending the epidemic, that we have a plan. We call it our blueprint. Our blueprint matches the strategy that was done with the previous task force, and so we plan on, mobilizing HIV testing all throughout the community to make sure that no matter where somebody is, they can get access to HIV testing. Making sure that we are engaged in the media and putting out events that help us to engage the media, so that, because ultimately, one of the big issues is that people think, oh, the HIV problem is gone. Everybody's been cured. We don't hear about it anymore. But the reality is that Fulton County has one of the highest rates of new HIV infections in the country. People just don't know about it. So making sure that there's testing in all kinds of places, making sure that we're engaging in the media, making sure that, as Dr. Holland talked about earlier, that our PrEP program is strong, and that anybody who wants to have PrEP can have access to PrEP, and not just our program, but really working with clinics and private physicians all throughout the county to make sure that they can kind of build up what they do in terms of PrEP. And then not just that, because my job is HIV prevention. I'm on the prevention side of things. But as Dr. Holland talked about earlier, if someone is HIV positive and has what's called an undetectable viral load, they will not transmit virus to anybody else. And so we do want to support those who are involved in care and retention in care, making sure that people who have HIV are able to be retained in care, because you would think of the simple thing. If you have an infection, you go to a doctor and you just keep going, you keep going, you keep going. But the realities are that a lot of the persons who are infected with HIV, HIV for many of them is like 10th on the list of threats in their life. And they got to take care of all of this other stuff too. So we have to really work with our clinic system and our primary care system to make sure that people with HIV have all the support they need so that they can then take care of their primary HIV needs.
Great. So tell us about hashtag Stop HIV/ATL initiative and the HIV/AIDS mobile health unit. I love the mobile units. And I love the t-shirts.
And this is for you. And if it's not the right size, we'll make sure you get a right size.
I love
Red
the
looks
color.
good on you. There you go.
So nice. Thank you.
So our hashtag Stop HIV/ATL campaign, as I said earlier, engaging in the media is something that we have to do. We have to capture the imagination of the citizens of Fulton County to say, and our tagline is, together we can end HIV in Fulton County. And so our hashtag campaign is it's a homegrown campaign. If you go to Instagram or YouTube or Twitter, at Stop HIV ATL. You can follow us and see pictures of everyday Fulton County residents who are all making commitments to be on PrEP and to get tested or to use condoms or to become virally suppressed, because ultimately it's really about the Fulton County Board of Health cannot end the HIV epidemic. I mean, that's just the reality. The Fulton County Commissioners cannot end the HIV epidemic. But we as a community of people, we as a community of Fulton County residents, we can end the HIV epidemic. And so that's what this campaign is really all about. It's all about getting the word out to communities about the things that they can do, and so that you can see your neighbor. Your neighbor's on PrEP. Well, if my neighbor's on PrEP, why can't I be on PrEP? If my neighbor's being retained in care, why can't I be retained in care? And on top of that, we do, through all of you mentioned earlier the funding that you were able to help us get, which is really, it's a game changer in a lot of ways. It's the first time that Fulton County specifically allocated money for HIV prevention, and through that, we're going to be able to take our campaign to the streets to not just have media about HIV, but also we have 2 large mobile health clinics that we will be deploying all the way from Alpharetta to Palmetto.
From Bankhead to Buckhead.
From Bankhead to Buckhead.
Like our late Commissioner Emma Darnell used to say.
Exactly. Yes. We'll be deploying all throughout the county, just showing up places to do an HIV test, because everybody should get an HIV. If you're having sex, get an HIV test at least once a year. Even if you don't think you don't need it, just get it. Because if everybody did that, at least once a year, get an HIV test, we would identify people with HIV, we could get them into treatment, and we could really end this epidemic. And so the media campaign and the mobile testing really all kind of work together to spread messaging all throughout the county about HIV testing.
You know, I'm really big on outreach.
Yeah, you are.
And I'm big on social media.
Yeah.
So tell our viewers, do you create a schedule for going out to the neighborhoods, or can they actually contact your office and request that the mobile unit come out to the community?
Great question. Once we get things going, we just started. We're in the process of hiring and getting our staff ready to go. Once we get set up, we will be posting. We have a website, stophivatl.org, and we'll be having a set schedule. Now, some things will be set. Like, for example, one of the great things is that we'll be able to not just, we offer PrEP. You can come to our clinic and we will certainly get you on PrEP. But with our new mobile clinic, with this new funding, we'll be able to be at Ansley Mall, the third Friday of the month for 2 hours. For anybody who wants to have PrEP, just go there. Just go to
it's like
Perimeter.
A mobile pharmacy.
Yeah, we don't really just be dispensing drugs from it, but we will be making sure that you can get all your labs drawn, get your prescriptions. So if you're up in Buckhead and our mobile unit is there, you don't have to worry about coming all the way downtown to see us. So we're going to be taking PrEP, and that schedule will be posted on our webpage. But also we'll be working on making sure that sometimes we'll be changing, sometimes we'll be at the public supermarket for 2 hours here. And we'll put that stuff up on our webpage so people can go to it and find out where they can go to access.
Okay, and when will we ever see an end to HIV and AIDS? In Fulton County, at least? I
would not have moved here from Philadelphia if I didn't believe that we could do it. I'm committed to ending the HIV epidemic. I believe that we can, as I said in our tagline, together we can end the HIV epidemic. Now, there's also a reality behind that. Ending the epidemic in technical terms means that you get below a certain number of new infections by % of the population. Will we ever get to a day where no one ever becomes an HIV positive? I'm not sure about that. But the National HIV Testing Strategy, National HIV AIDS Strategy that was put out under President Obama has a really great phrase that the vision is for there to be a day where HIV infections are rare, and when they occur, they are detected quickly and met with all the support needed to keep that person safe and in care. So that's really kind of our goal. It'll be hard to say no one will ever get HIV, but we can certainly work hard to get it below a certain level of infection rate.
Oh, that would be wonderful. And so again, tell people where they can get tested and
Sure. The best thing
the
to do right
importance of it?
now, there's two places you can go to. You can find us in one of two places. You can find us at the Fulton County webpage. If you use Google Fulton County Board of Health, you'll find our webpage. And you can find us through there, and you can get locations for testing for that. You can go to stophivatl.org, and you can find testing locations from that. You can slide in our DMs on social media and just ask us, where can I go to get tested? I live in such and such a place, and we will get back to you and help you figure out how you can get an HIV test. There's no, HIV testing is free, it's convenient, it can be done in 30 seconds, 60 seconds, but it's a game changer that we're able to do if you can get tested, yeah.
And what can we do to reduce the stigma against people living with HIV?
That's a really great question. Stigma works in two ways. One, it's stigma that drives certain behaviors. It's all of the shame, all of this, you should be ashamed of yourself, and child, close your legs, and all that stuff that we've taught people, just don't do it. That kind of stuff just shames people and makes them feel bad about themselves, which actually causes people to engage in all kinds of, they engage in drug use and sexual activities because they bury them underneath. And so stigma is something we really have to address, and we're spending a lot of time this year in particular talking about stigma, how to address stigma. One of the great things that in terms of the funding that you were able to help us get access to, one of the side benefits that we're able to put together is in the fall we'll be holding our first HIV Church Summit. And we
that
have,
is so necessary.
It is really necessary. We have Dr. Michael Eric Dyson from Georgetown University is going to be one of our keynote speakers. Dr. Michael Walren from First Corinthian Baptist Church in Harlem, New York, which is this big, huge mega church in New York. They'll be coming so we can really engage because the church wants to help. The church wants to do better about HIV, but they just need the tools to really understand the language, what to do, how do I get my health and wellness ministry around to respond to this. So through all kinds of things like that, through that summit, which will take place, it's going to be at Morehouse University. October 19th. It's going to be about 300 people we're anticipating are going to be there. We have our World AIDS Day event coming up December 1st. All kinds of ways we're really trying to engage with people from all different levels. And that's one of the reasons we have people from all throughout Fulton County part of our campaigns, because if your neighbor is taking PrEP, if your neighbor is taking an HIV test, let's just remove the stigma and let's just engage in our healthiest selves.
Absolutely. Well, Derek and Dr. Holland, thank you so much for joining us today. And I really appreciate both of your contributions to this very important discussion.
Thank you. Thank you for your leadership in all this, too.
I'm
really
looking forward to us doing even more and just really eradicating HIV/AIDS. And stay with us. We'll be right back.
Dad?
Just 1 minute, okay?
Hey, Bobo, do trees tell each other stories?
I'm sorry. I'm afraid I don't know that.
Hey, why don't we go find out? Listen.
Do clouds take naps?
I couldn't tell you.
Can birds draw pictures?
I don't have an answer for that.
Dad, do stars visit their friends?
Look!
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back. Here are 3 key points to remember when working to raise HIV/AIDS awareness in your community. Number 1, get educated on the issue. Attend the next Fulton County HIV/AIDS Prevention, Care, and Policy Advisory Committee meeting. The more you know about prevention and care, the more you can share with your community. For more information on upcoming committee meetings, you can visit www.facebook.com/Fulton HIV Task Force. And number 2, help reduce HIV stigma and discrimination. HIV/AIDS is a deeply rooted social issue that can discourage people living with the virus from disclosing their status to their family members and sexual partners. We must continue to fight against the stigma for those living with HIV/AIDS by continuously promoting a healthy dialogue between individuals and communities, in hopes of inspiring community support and a path to new solutions. By using hashtag StopHIVATL, not only are you raising awareness, but you are eliminating stigma and inspiring a community-wide commitment to reduce HIV in Fulton County. And number 3, get tested today. There are multiple HIV testing centers in Fulton County where HIV testing is free, fast, and easy. Locate the closest HIV testing center near you or stop by the Fulton County Board of Health Sexual Health Clinic at 10 Park Place South on the 5th floor for a free HIV test today. And when we come back, I'll wrap up today's show with a look back at the Juneteenth parade. Stay with us.
I don't remember how it started. Our back and forth. Victory. Fumble. Repeat. It always came back.
Okay, here we go, throw it!
Yeah.
You probably don't remember what you told me,
That was perfect.
but I heard every word.
Nice.
Welcome back. I was chosen to be the Grand Marshal for the biggest historically black history parade in the city of Atlanta. The Juneteenth Atlanta Parade and Music Festival celebrated one of the greatest events in American history, the ending of slavery in the United States. The 3-day festivities included family fun activities, musical guests, cultural cuisines, fireworks, fitness challenges, yoga in the park, and Fulton County services, and a parade down Martin Luther King Drive. The parade not only celebrated the life of our ancestors and the acknowledgement of present and future generations, but also commemorated the 50-year anniversary of the Martin Luther King Jr.'s assassination. What an honor it was to lead such a grand ceremony which focuses on African American freedom and achievement while encouraging continuous self-development and respect for all cultures. That's our show for today. Special thanks to our guests for joining us, and a special thanks to you for watching. Feel free to contact our District 4 office anytime by calling 404-612-8226 or emailing at district4@fultoncountyga.gov, and be sure to connect with us at FullCoD4 on Instagram, Facebook, and Twitter. Until we meet again, I'm your District 4 Commissioner, Natalie Hall.